This is the wound assessment video for integumentary class. I have my patient Mike here. Mike has a pressure ulcer on the bottom of his right foot. It's going to be underneath his big toe, and it's going to be on the inner half of his right foot. So Mike, my name is Bobby, and I'll be your student physical therapist for the day. And what we're going to do here, Mike, I'm going to get a very brief medical and social history from you, and then we're going to move on to some tests and measures, and I'm finally going to finish with some goals that I want you to meet. So Mike, how did the injury occur?
I was working out and I dropped a weight that landed on the outside of my foot, and the pain was so severe that I had to compensate for it by putting on my weight to the inside of my foot.
Okay, and when did that injury occur, Mike?
I dropped the dumbbell about 3 months ago, and shortly after that is when the ulcer started to appear, but I believe in the last month it's been starting to heal.
Okay. So Mike, we're going to move past that. We're going to get some general information from you. What's your age?
I'm 23.
23. And Mike, what is your living situation?
I live in an apartment complex on the 3rd floor with 3 roommates.
Okay. And Mike, if you ever needed any assistance with your wound, would one of those roommates be able to help you?
Yes.
Okay, good. Okay, Mike, so what is your occupation?
I'm a personal trainer.
Okay, you work at a gym?
Yes.
Okay, and on a typical day, how many hours do you think you stand or on your feet?
Pretty much the whole time, so probably 8 hours.
Okay, so about 8 hours a day. Mike, do you take any medications?
No.
Okay. Do you have a family history of cardiovascular disease or any other illnesses that we should know about?
No.
Mike, do you have diabetes?
No.
Okay. So Mike, what is the pain in your foot on a scale of 1 to 10?
About a 3.
Okay. And other than the pain, is there any other symptoms that you have?
No.
Alright, Mike, so I know that you're a weightlifter, and because of this wound, you haven't been able to lift in the gym as much as you'd like. So that would this definitely be a goal that you'd like to be able to rehabilitate this foot, and then you could get back into the gym?
Definitely.
Okay, so we're gonna move. That's gonna be the end of the brief. I just want to do a very brief medical social history. You've given me enough information, and what we're looking at here looks like a very localized pressure ulcer, and I'm going to do some tests and measures now, just to get a baseline of where we're at, and then we're going to end with some rehabilitation goals for you. Okay? Okay. All right. So now we're going to begin with the measurements here, Mike, and I'm going to take the measurements of your lower leg here, the calf region, to make sure that we don't have any edema or swelling in the leg. So I'm going to begin here at the malleolus, and normally when we do this, we're going to test both legs, but for purposes of time here in the video, we're just going to do this on the affected leg. Okay, so we're going to do it around the malleoli here. Check for any swelling and edema. Okay, so we have 28 centimeters on the malleoli. We're going to go 10 centimeters above that. I'm going to take another measurement. Okay. And I'm just going to lift your leg up here for a second. There we go. Okay, 27 around the 10 centimeters above the malleolus there, and then we're going to go to the tibial tubercle up the upper part of the lower calf here, or the upper calf here. Okay. Come around here. Good, we have 38 centimeters there. And so Mike, I looked at your other leg and we compare the two. You can see that they're both pretty similar. So I don't think that swelling or edema is a problem here. Again, the pressure ulcer there, it's unrelated to any venous insufficiency or arterial insufficiency. What we have, what we have there is directly a pressure ulcer related to you just putting too much weight on the inside of that foot there. So we have no swelling or edema due to diabetes or anything like that. So that is definitely a good sign. And next thing we're going to do here, Mike, we're going to move on to checking the sensory system on the bottom of your feet here. And with not going to use a microfilament, I'm going to use the bottom of my reflex hammer here. And Mike, what I'm going to do here is I'm going to touch your bottom of your foot just so you know how this feels. Okay, and then I'm going to have you close your eyes, and I'm going to be pressing this on the bottom of your foot, and I'm going to ask you whether you feel it or not. Okay, so when I press into it, I'm going to say, do you feel this? Just say yes or no. Okay, feel this?
Yep.
Okay. And here?
Yes.
Here?
Yes.
Here?
Yep.
And here?
Yes.
Okay, here?
Yes.
And here?
Yes.
Okay, and how about here?
Yes.
Okay.
points.
Okay, that's good, Mike. So we have normal sensory function on the bottom of your foot. Even though the outside of your foot where you drop that dumbbell, that's good too. That's definitely a good sign. It means that your sensory system is working well. And so far we have no problems with the swelling or edema, and no problems with the bottom of your foot in terms of your sensory development. Next thing, Mike, I'm going to test your range of motion here. So we're in the neutral position here. I want you to keep that. Okay, and keep it right there. We're going to go, just going to bring this up just a little bit, and so we're on the outside of the fifth metatarsal here, pointed towards the fibular head. And Mike, I'm going to move Mike into dorsiflexion. So Mike, can you bring this foot and bring it towards your body? Good. Okay, good. So just relax. So Mike has 20 degrees of dorsiflexion, and that is normal. That's the upper limit for the range, so we have good range of motion there. And now, Mike, I'm going to have you bring the foot down towards the floor if you can. There we go. Okay. Good. And Mike has 45 degrees of plantar flexion, and that is close to the 50 degree range mark. So we have good range of motion in our feet here, Mike. So there's no disability or liability here in your range of motion, which is good. Okay, and next, Mike, we're going to move into the strength of your feet. So I'm going to first check the muscles on the front of your calf here. And so what I'm going to do, Mike, is I'm going to have you bring your foot up towards your body again, and I'm going to pull down, and I want you to hold this position. So hold this position. Good. Okay, so Mike has a rating of 5 for strength for dorsiflexion, and Mike, we're going to come back to neutral. And I'm going to have you bring your feet down towards the floor again. And again, I'm going to push up into your foot, and I want you to hold this position, okay? Alright, good. So Mike has a rating of 5 for strength in the dorsiflexion and plantar flexion. So Mike, we have normal strength in our feet. Your ankle has a good range of motion, good strength. So really what we're looking at here is a very localized wound here. And once again, as we said before, it's definitely in the healing phase, okay? So Mike, we're going to move to, I'm going to check your pulses here. I'm going to check the dorsalis pedis pulse first, which is going to be just lateral to the tendon of the first metatarsal, okay? So just relax, Mike. There you go. Okay, so Mike has a good pulse on his dorsalis pedis pulse, a 2+, normal pulse. And next we're going to check his tibialis posterior pulse, and that is going to be just posterior to his medial malleolus. Okay. So again, just relax for me, Mike. Good. So we have normal pulse you have normal pulse on both sides there, Mike. So once again, we don't really expect to see any problems here. You have good pulse, no swelling or edema. Your strength is good. Your range of motion is good. Really, what we want to do here, Mike, is we're going to get this wound healed as fully as possible, and then once we do that, we can get you back to doing the activities that you want to do. Okay. So we're going to move into a description of the wound. Again, we have a pressure ulcer at the bottom of the foot. Stage 2. It has not moved into the dermis or below. And again, looking at it before, what we have here is it's a pretty clean wound. It's pinkish around the edges. We have no undermining, no pitting, and it's already in the granulation. There's some granulation tissue in the middle there starting to form. So we know that we're definitely moving into the rehabilitation and the remodeling phase. It's a clean wound. The wound edges are fine. They're not rough. It's not excessively dry or wet. It's a pretty clean wound, and we're definitely moving into the remodeling phase. So checking for the temperature, there's no difference in temperature around the wound, and the skin color around the wound is it's the same. Once you move past the wound edges there's no difference. Alright, so as we look at Mike's lower extremities, we can definitely tell that he has good skin color. His nails are healthy, his hair is healthy, so there's no decrease in blood flow to his lower extremities. Again, he has good blood flow to his legs, no differentiation in the skin color, healthy nails. And the last thing we're going to do here, Mike, is we're going to measure your wound, and I'm going to do a direct measurement. So I'm going to get out my tape measure, and we're going to go measure the length at the longest part and the width at the widest part. So here we're going to take the measurement here at the top, and we have 3 centimeters for the length, and the width is 2 centimeters. So that is the direct measurement for the wound, 3 centimeters by 2 centimeters. And we can see that the wound was bigger than that before, and through it's begun the healing phase and it's gotten smaller. So Mike, that really concludes the tests and measures there. And taking a step back, what we want to do here is get this wound fully healed. And my goal would be that within 4 weeks we get the wound fully healed and recovered, and have you walking at that same time without pain on the inside of your foot. So that concludes the assessment, Mike. Thanks for being a good patient.